Hello and welcome to the latest episode of the UK Psych Health and Safety podcast. I'm Sheila Lord, and as always I'm joined by my co-host Peter Kelly of the UK HSE, and our guest this week is the lovely Su Chantry, who is Clinical Director for SKC Occupational Health. And in addition, Sue also supports Williams Racing with their health and well-being as well. So welcome to the podcast, Sue. Great to have you.
Hello. Yes, nice to be here. Thank you.
So Sue, you're obviously working in occupational health, and what we wanted to do today is to have a chat with you about the role of occupational health in psychosocial risk, health and well-being. So could you tell us a little bit about kind of the work that you do and the role of OC health professionals in that area?
Yeah, of course. So occupational health work very autonomously. We are there as advocates for the employer as well as the employee. We have clinical background, so we're medically trained. And our speciality is very much about offering workplace health guidance and support. We advise and educate managers, HR, organisations, as well as employees. And it really just helps them to, work along clinical guidance as well as safety guidances. And it really develop and optimise a healthy and productive workforce. We work very collaboratively. We certainly have to work within legal boundaries and regulatory compliances, but we also give much more in terms of optimising business health management in the workplace.
Okay. So you've come across the new standard, ISO 45003. What are your views on the standard and how kind of the standard is going to help to support your profession?
I'm really excited that we now have a framework and a tool that we can actually really use to guide and frame some of the psychosocial risks that have actually been there for a really long time. And I think it's been an ad hoc model of support from mental health and wellbeing in the workplace historically. Occupational health aren't actually counsellors, but we are able to advise and guide. But to now have a framework that is accredited from an international perspective is really exciting, to be able to explore that and use that to pin strategy and guidance and support to employers in the context of having a real accredited framework that's recognised, standardised, and it means that we can all work to a set programme, and I think that continuity will be really, really valuable. Certainly as a clinician, from my perspective, to work to those standards really means that we can deliver optimum guidance and support, and probably at a time where it's never been needed more, to be frank. We're certainly seeing in occupational health post-COVID situations of a really high incidence of referrals for mental health management from managers and employers. And so actually to develop this tool now at this time for us to begin to explore that will help everybody. We work very collaboratively with HR and with health and safety already in terms of legal and safety standards. So it just makes natural sense to me that we're now recognising a psychosocial risk as equally as we've done for years in regards to noise management, for example, or the cost risk management standards. Regulation 11 has always meant that occupational health has had to work and support that. So to have that now with the 5003 is really exciting.
Excellent. And how are organisations responding to the standard that you deal with, and organisations, maybe outside of your kind of?
Yeah, I think it's still very much an exploratory stage, if I'm honest with you. It's still very, very new. In fact, even within occupational health, I would say that we need to do a bit more research, a bit more understanding, working with audit sort of organisations to help and support us to get together the management standards to be able to deliver it in a constructive framework. Certainly, some of my clients that I work with, particularly in relation to the fact that mental health is certainly a high priority for them to manage in the workplace currently post-COVID, they're very, very interested in it. And I'm currently just going through some sort of exploration stages to understand it a little bit more, so then I can guide and lead from my clinical experience to be able to work through and develop that with health and safety colleagues and HR colleagues who are obviously procuring my services to support them. Certainly the engagement is one of interest. I haven't actively implemented it at the moment, but I think that's because it's still very much at a foundation stage.
Yeah, it's only like a month old, really, in terms of it's visibly out. Come on, Sue, me and you have been in this job about 20 years, and we followed this
only
journey.
20. That
20.
makes me what, 25 years old?
Absolutely, 23 for me. 23 for me. But you know, during the course of that 23 years, there's been a lot of changes, hasn't there? A lot of attitudes have changed towards mental health. Where do you think people's attitudes are going to go with regards to, you know, psychosocial hazards and depression and anxiety post-COVID? Because there's some evidence at the moment coming out of papers that we've seen in the BMJ of 20% increases in some sectors with depression and anxiety in our own sectors, in the healthcare sector. You know, 45% of sickness absence in the NHS is now mental health. And as an occupational health nurse and an occupational health professional, do you think we'll see a huge increase, a wave of sort of referrals?
I think those figures are underquoted. If I'm really honest with you, Pete, I think it's always been there, but I think the dialogue is one that it's actually an open context. We've got much more of a open dialogue in regards to mental health management in the workplace. It's no longer a topic that you just either deny or pop under the carpet and it doesn't exist and just talk about back pain, which was historically the mask for mental health. I think employers recognise that they do have a duty of care to recognise the support and the duty of care they have to their employees for mental health. And I think actually that is a demand. Part of an employee's request now in terms of benefits and what they expect from an employer is, how are you going to support me psychologically as well as physically? I think the dialogue is there, and I think actually the statistics are probably far higher in the presentation currently, and certainly within, you know, anecdotally with my peers and professional colleagues, professional referrals from organisations, as you say, within the health sector. I don't work in the NHS sector for occupational health provision, but recognise very much that that is the dominant work for occupational health services within the NHS to manage the fallout post-COVID management and the acute work that staff have had to have delivered in the NHS in the last 18 months. But I think also in the private sector, there's been a lot of impact of furlough, virtual working, risk of job security, as well as actually the general anxieties that have come along with COVID in a general society context. Overflow it out of the work context, those personal circumstances, people having to work and juggle school care, homeschooling, all of those other demands that life has brought everyone during lockdown, and still having to maintain a professional level of work. And people haven't worked harder than they've ever worked before in some circumstances. I absolutely think it's going to be a pandemic of its own, really. It will be a crisis point. I think it's reaching a high peak, and this is where support from occupational health is really critical, because we can bring in, you know, risk assessments. That the real positive with this particular framework is that it's looking at identifying the risk and putting in place control measures that risk then doesn't become an issue, a hazard, as opposed to actually more of a reactive model where you wait for the fallout and then you plug those gaps with either managing sickness, absence, long-term absence related to stress, anxieties. And so actually this is what's really positive about having a structure such as this. It's actually identifying that there is a risk. And I think employers, organisations have to recognise what the risk is. And it isn't just, as I said before, picking up that there's a noise risk, so let's produce some hearing protection. There are psychosocial risks now, there's mental health risks, and it's all unique to various organisations. You know, as you've already referred to, the NHS management of mental health concerns within the trusts right now is probably as a relation to some of the acute work and the resourcing challenges that staff have faced in the last 18 months. I worked for 4 months on the wards back in the NHS, having not worked in the NHS for 25 years, last spring at the very beginning. And I have had mental health concerns related to my own personal health. As a result of that, I've been able to manage that. And I only worked for 4 months, and I had the choice to manage my shifts. Colleagues of mine have not had a respite from that at all. They weren't able to manage their shifts, their workloads. And so I think it is something that's a real concern that we have to... Sorry, Pete, yeah.
I've talked about it with you, haven't I? Said there are 3 parallel pandemics, and the first two, the recession and the global influenza pandemic, will pass. The influenza pandemic maybe will take a year to 2 years to get through it. You know, before we see sort of the possibility that we're managing it. But clearly, the mental health will carry on for a significant amount of time after it, and I would say generational. I believe 14, 15-year-old kids that are going into work 3 or 4 years now are going to need to their mental health is going to have to be managed.
And I totally agree with you, Pete. My daughter is 18, so she started her degree last September, and you know, that group of amazing university students have been kind of left a bit behind. They've undertaken their year of study in a virtual context in halls of residence. They've moved away from home the first time. They've not had the social engagement that we probably had the fun of enjoying when we were at university. And that, you know, that is a real fundamental baseline to their mental health challenges they've already had. They're going to come out of their university experience then looking for work in employment sectors that actually I think they're really going to be very self-aware about what their expectations are to have the mental health support from employers. And I think, you know, organisations have to recognise that at basic recruitment level. Occupational health will manage referrals for mental health. That's what we're currently doing at the moment, and we will advise and we will guide businesses. But I think there's also an accountability from, you know, managers, organisations to be able to apply those guidances and advice. And actually, as I've already said, that's where occupational health can also look at trends and patterns of referrals that may well actually mean that occupational health can support strategy to ensure that those risks are managed before you need to make those referrals, because that's the ultimate, is really ensuring that you've got good education, a good mental health awareness framework, and a culture that is not being kind of labelled as, you know, you're a bit bonkers because you've got some mental health issues. And I think that the culture is changing, the dialogue is changing, because society are talking about it much more. It's been a headline piece as well as the COVID figures and stats. You know, as you know, I work in motorsport. You know, we talk a lot about the work that I do within the motorsport sector, and I'm really proud of how, you know, the teams on the grid have really recognised how they can support and manage mental health. Beginning of the season, this is pre-pandemic, you know, there was a big advert about men's mental health, and that was a promotion through the grid, through the TV channels, with lots of active campaigns. And I think that dialogue coming from high profile sports such as motorsport football, for example, all of those high profile organizations where, again, historically it's, you know, it's a highly competitive environment, and if you don't meet the grade, or you kind of discuss that you've got a mental health concern, then actually you're kind of a disposable commodity. Is not the case so much now. And I think it is about seminars, workshops, education, and that's where the 45003 can really support a strategic focus on managing risk. And occupational health has got a massive part to play with that, without a doubt. It isn't just about an organisation ticking a box and having a framework, because I think you do need to collaborate. I think one of the things that I maybe slightly am concerned about, and I think there does need to be a big education piece on this, is actually an important part for health and safety to play in this standard. Traditionally, health and safety has been about managing slips and falls and manual handling and looking at risk assessment for noise and cosh. And I think it's also about educating at ground level health and safety managers to be aware that actually mental health is equally a risk, as well as the slips and trips and falls and the tick box kind of legal standard frameworks that are managed in the workplace.
No, and I mean, it is. I did an open letter to the EAP and occupational health providers in one of the magazine interviews, in which I said it is time to focus on prevention rather than treatment and cure. And I think there has been, for a long period of time, a focus on the treatment of the individual. Actually, for me, the power of occupational health is what it does to put in systems and processes in organizations to manage people's health in a way that makes the people return from work either not same as, or if not healthier. But yeah, there is you know, we can put a guarding on a machine, we can put anti-slip measures, we can tell you to pick up 12 kilos, and we can make bags that are 12 kilos, and we can make all of these mandatory physical interventions. But what we do is to do the same for mental health, which is we need to identify things and go, okay, if you've got someone that's got high demands, really, really high demands, they can't manage, they can't cope, reduce the demands. Don't say I can't reduce the demands because I've got the system. Adapt the system, is it not? And that's what, if let's say if you were on a line and there were 15 people and 7 reported they had back problems, what would you do, Sue? Would you say they've all got bad backs? Or would you, yeah. And I think that's the medical training is really important, you know, and the occupational health background to look at systems and so I
agree. I think that's where a dual role is really quite key, and that's something that I think occupational health can bring to the table with belts and braces on as well, because we do have the clinical skills to be able to support an individual who may feel that they need to speak in a really confidential context, and because of our clinical bound duty, we have to maintain those confidential discussions and support an individual as they need. And we do probably have to medicalise that, or maybe not necessarily clinically medicalise it, but have the skills to know where we can refer and offer support outside of the context of the workplace. But I think the key message as well for occupational health is to really emphasise to that employee that the confidentiality framework, whilst we will totally respect it, doesn't really work unless we are in a position where we can report that back. And it's still in a skillful context that not every single detail is disclosed. But actually, if we then identify a trend or a pattern with a number of employees, then that way an organisation can identify where they can bring change and to the processes or change to the demands. And it is having that standards that are already developed through the HSC in terms of those kind of standards and working to those. But sometimes I find that the two are slightly disconnected. So, you know, staff are referred to occupational health because actually it's a bit medical and it's mental health and we don't really quite know what to do. Oh, let's send it to occupational health because they'll sort it out. And actually, it isn't our role to sort it out. Our role is to advise and to guide. We will certainly work with the individual to help them through that particular crisis, or those, you know, physical illnesses that might be presented through, you know, mental health and psychosocial issues. But at the same time, we do also need to advise and guide the employer to say, look, this is what we're seeing, and this is, as you say, we're there to educate and support and discuss with health and safety, and it has to come from the top. If you've got the leadership buy-in at the top, then they will really then support the processes that might bring about some of those changes. And if it is demands and you need more resources, or if it is workload, or it is fatigue, all of those additional elements can be then addressed within a framework that I think the ISO 45003.
I thought you were going to say 45003.
My numbers and the ISO standards do get somewhat muddled. A colleague of mine can vouch for that, because I've just had to go through the 15189 for COVID testing. And so the 45003 sits parallel with the 45001, and that's an interesting relationship, because actually, you know, that is a recognized standard. Because it's kind of black and white, there's no kind of contextual kind of grey areas with it. It's really recognized. I think the 45003 has some challenges just because it's suddenly got the word psychosocial in it, and people then suddenly go, oh, you know, what's that? That's all mental health. Oh, and so it would be interesting to see, as you say, because it's only a month old.
Yeah. But
how that kind of context goes in, and hopefully that it will be, you know, given the respect and the value that it deserves.
Because I think 45,000, you'll know, 45,001 sets out a safety management system. Then they went, well, actually, that's hierarchy of control and the 5 principles. And the first principle is eradication of the risk. Well, then, okay, so one of the reasons for 45,003 as well, actually, there are some jobs that functionally have degrees of stress in them, okay? Now, if the job is stressful, you can't eradicate the job. Controllers, police, ambulance, long distance truck drivers, are a whole range of professions that have
race engineers,
exactly. And so so then it was saying, well, if you can't eradicate it, can you change it slightly? And this was our seminal argument, as I don't know if you've heard, we had over 45,003, and I said, if you want it to sit with this hierarchy of control, you have to accept that the way this is assessed, implemented, and changed is at the primary level, which is an organizational bit, the tertiary, which are things that you do to equip people to managers to be better managers, and at the tertiary level, where you get people in, you know, and you deal with mental health issue. And I think there's a powerful message on well-being, particularly amongst all the sectors, including the sector that you work in, which is, if you're promoting positive mental health, you're doing a secondary intervention. And it's about making the workplace. And I've obviously had the opportunity to come down to your factory and see to see them as they were building the cars. And it is a stressful environment, but it's a very rewarding and stimulating environment at the same time for those people that are there. You know, just doing those tweaks with the little spanners and stuff.
Yeah, and I think that's a good example to use as an analogy, because actually in motorsport we're kind of on a time critical line. You know, in the factory, the components and the parts that are being produced, it is time critical. And certainly with the race calendar now, it's been concertinaed anyway because of COVID. But actually then you've got additional races, you've got the flyaways, you've got all of those additional elements that come right down to the fundamentals of the logistics. You know, the perception is, you know, just on the grid, on the day, on a Sunday, and it's all, you know, fine. But actually the background, which you have the pleasure to share the day and see and share with me, is absolutely, the well-being runs hand in hand. And if you look at a holistic model of kind of developing a well-being strategy, you know, the risks and the physical risks, the travel health risks, all those other elements, the cost, the noise, those standards that come hand in hand with, we're using motorsport as that example. But actually, if you then align the well-being, you've then got much more of an engagement, much more of a positivity, And if the open dialogue is also, it's okay to talk about your mental health if you find that you're struggling, actually really then builds a really good positive rapport and relationship. And I'm proud to have been able to sort of develop that within the kind of strategy focus that the business has. And I think by having an in-house occupational health, that has particularly helped. But I think occupational health in the context of provision model, it is a challenge because it definitely has a business focus, and it's a sort of a headcount exercise. But I think wellbeing is part of a whole return on investment for businesses.
Exactly. Now, and in your sector and in other sectors, but let's reference to your sector, your people are happy in their health and their well-being, then their performances across the team become impacted because their people are focused, aren't they, on the task that so those extra seconds, or that extra half seconds or quarter of a second that you need, if you've got people who are engaged and feel that their mental health is being looked after, then they're then I believe that goes across all aspects of the business, including what you produce at the end, which is a car that does what it does. And drivers. And it's not just about the drivers, is it? It's about everyone. It's a team thing. What was beautiful to see when I walked through the factory with you and the officers, hi Sue, hi Sue, hi Sue, hi Sue. Yeah. So they knew who you were. You were very much a part of it. And I think that's really important, that our health is very much a part, of that, and I think that's it.
And actually, in the context of some of my other private clients that I work with, the organisations that I have in the area, it is very much about having an engagement with the staff. Occupational health, you can sit in the office and you can have the door closed and you can do your case management and you can, advise on strategy. But if you don't get into the nuts and bolts of an organisation, you don't understand the culture. And so therefore, how can you advise your HR colleagues or your health and safety managers or your directors even about their health and wellbeing strategy if you don't understand the context of what's going on? And as you will have seen, my informal approach, call them my kind of rounds as I go round, is actually as well, you learn a lot about how people are feeling just by observation. As you've kind of alluded to, we're long in the tooth in our practice. And so, we're very skilled in occupational health to be able to see those nuances without someone directly telling you. If you get to know your colleagues or your clients, if you're working in a private context, such as my consultancy work, that's really important because you can see what's going on in the kind of the undercurrent of the culture or the behaviour changes that come about through stress or anxiety, and recognising. I think it's also very important to recognise that, for example, in the context of the current COVID, I've alluded to it already, where, people's personal stress factors that have come in a context of mental health management can then overflow into workplace stress. So sometimes it's not just about a workplace being a stressful environment for someone. There's the stress bucket, as we talk about, usually can be trickling along quite nicely, and you can manage those work stresses, the challenges that come about your kind of everyday life. But you throw in a few extra kind of gallons of stress that comes in from a personal point of view, then actually the two end up blending, and it's hard to then disseminate that. So I think, the framework and the hierarchy of needs definitely can be managed within change and workplace demands, and looking at processes and how things can be focused to support wellbeing strategy. But at the same time, it is also recognising.
It doesn't have to be at the individual level, does it? I mean, do you remember when we met in Birmingham? And do you know what we were doing?
Yes.
We were on massage chairs.
How much fun was that?
It was great in the conference, and we had it, and that's how we met. But actually, that was a tertiary intervention. It was great. I came off. I felt okay. I didn't walk away feeling any less stressed, but I did obviously get to meet you, and but it's so often the focus is down on that tertiary stuff, isn't it? Let's give you yoga. Let's give you apples and pears. Let's make them mindful. Sorry, individuals, not organisations, or organisational resilience and organisational mindfulness would be a great thing, would it not? But and I've talked about that before. But it's fascinating, and in with us, it's about what can you do at the overarching level. It's no good. I talked about this when you can't put resilient fish into a pond, because this is what I was told once at a conference. We want resilient, robust, strong fish in our pond. And I stood up because Kerry Cooper was next to me, and I said, "Okay, I can't say anything. You need to say this." And I said, "In my experience, I've killed loads of goldfish." And when the pond man came out, he said, "Your filter's blocked." So the point, you look down and making it on the individual, but you don't sort out the filter, then you're in a
totally
difficult
agree.
place.
And I think it's also giving managers and leaders the tools to know how they can support and manage. I've worked with a lot of organizations where managers are absolutely amazingly competent in their management of a task, or they're usually promoted because they're so good at what they do. But sometimes that doesn't then align with some of the people skills that have to come with managing staff. And I found that a particular element of the role that I deliver within occupational health is to support those managers and give them the facilities and the education and the training to give them boundaries. And again, coming back to the 5003, is actually that really helps us contribute to giving managers some tools that they can then support staff within the context of their management styles and their management frameworks, and having those dialogues through a performance review where you're ticking a box of what is visible, what is a process driven kind of assessment, is actually giving managers the confidence to say it's okay to also say, how have you been feeling in context of your mental health and the work that you've been doing as part of a whole PDP process follow-up. And I think, again, you putting that into context, that can be delivered through an HR context, but sometimes HR don't know what they don't know. And I'm really passionate about the collaborative role that occupational health kind of is there as a sense of guidance, the right education, the right tools, the right information to help leaders, managers, departments manage health and well-being, as you say, to bring a culture change and bring a business change, and not just about the individual reactive quick send them down the corridor to occupational health because they've had some sickness absence related to stress. The GPs put stress on there. What do we do?
Run away.
Well, and I think in that context as well, I do have to say that GPs do have a part to play, and I think promoting something like an awareness campaign through GPs who, don't get me wrong, through the current COVID work have been absolutely backlogged, but I think GPs need to get out of the habit of just signing someone off sick with stress, and again promoting and perpetuating a kind of sickness absence model of, we've got 3.5 minutes in your consultation, let's just sign you off sick with stress. That fit note gets sent into HR, red flag label stress, but nobody knows what to do because the GP signed them off sick. Again, it's using occupational health to say, well, look, this is looking like a pattern, what can we do? But also getting GPs to think about good work can be good for health, and good work can be promoted with some support and collaborating with occupational health to align it, that you don't then get into that reactionary model and medicalising some issues that might actually just need a little bit of guidance and support.
Yeah.
And I think as well,
the psychosocial characteristics of.
Again,
hello,
Sheila. Sheila.
Sorry, I think I've got a bit of a delay on my network on this side.
No, just Peter and I were just chatting away, and we forgot it's a three-way conversation. Apologies.
Now, just thinking, with the ISO standard now, when we look at psychosocial health in the workplace, has to be systemic, doesn't it? It has to be knitted into the organisation's culture. Any business, we've got quality control for products and services. We've got quality controls around our management system. We've got quality controls around our financial systems, but zero quality control around culture. And for me, what's exciting about ISO 45003, because we've got quality control for people and culture that we can measure, that we can spend, that we know the areas to look at, and it becomes very systemic within and it normalizes it. It's not we're different because we've got stress-related issues or mental health problems. It's just a normal part of doing business, is making sure that we are focused on looking after our people and the culture of our business.
Totally agree with you, Sheila. And I think that's why it's been so good sort of collaborating with you over the last few months as this has been developed, because I think it is absolutely fundamental. And I think the fact that it's recognised as a framework, it's ISO accredited, it isn't just coming off the back of a bandwagon, it's a really respected, valued, accredited standard. And I'm really looking forward to sort of exploring it a little bit more, and putting together a framework with my amazing auditor colleague to just really help us work through it, so we can deliver this as part of my sort of consultancy framework for my clients, because I think they deserve it, and they don't know what they don't know, but we all have a part to play in educating and really clarifying in exactly that context. We put standards against so much else, and we would never dream, as you say, of going through a financial system without a quality control measure. But with human health, it's sort of kind of bit by the by.
Exactly. And if you don't get your people and your culture right, where's the success in your business?
Absolutely. I agree with you wholeheartedly. And that's what's really exciting about, I think, the vision and the future model of occupational health provision. Maybe historically it has been a bit of a culture of sitting in your office waiting for the referrals. And I think, we as occupational health clinicians have a duty to deliver a really proactive, strategic, focused approach to the support that we can offer clients. And actually the fact that it has a return on investment, because that's the end line, especially in the private sector, but equally within the NHS, to be fair, because obviously that's still running where it has to think about costs and value.
Absolutely. And I think it's not just a cost element as well, because, this takes more than money being thrown at it, doesn't it? Commitment, and it has to take time. There's no silver bullet solution, whichever way you approach it. To be systemic, it has to be done and brought in. We're going to kind of close up now and finish off today's session. But we generally always ask our guests, what would be as a closing question, what would be your advice to business leaders? Like one simple kind of nugget for them to kind of take away when it comes to psychological health in the workplace.
Utilize the tools that you've got around you, and if that means looking at seeking occupational health guidance to give you some advice in regards to that, then definitely consider the value that occupational health can bring to your business, for small, medium and large enterprises, and whatever model of occupational health the business decides to use, that's totally their prerogative. But I think that would be my advice as an occupational health professional, without a doubt, is proactive, be proactive, and look to get a strategic sort of risk assessment model to your health and well-being. Don't just buy a bunch of fruit and put it on reception and think that you've ticked that box.
Unless it's kiwi fruit, because that's quite exotic.
always interesting seeing a pineapple when you've got a workplace fruit bowl, because it's kind of not just grab and go.
That's awesome advice, Sue. And for those of you that are on the podcast, I have to ask this question, Sue, but is there a Yeti on your chair?
It's not a Yeti, it's a sheepskin. I actually came home to do this podcast because actually it's very comforting just sitting. It's cool, well, you'll know all about sheepskins and use of sheepskins in.
It does look like a Yeti, but that's okay. I like Yetis.
As long as I don't look like the Yeti.
No. But it's been wonderful to have you on. Yeah, you know, it's not always nice to have your mates on, isn't it, as well? Someone that you can chat. So we were just like in a coffee shop there, weren't we, for a while, just like chatting away. But you know,
well, hopefully we managed to share our passion for
and
workplace health management.
You know, I have a lot of respect for the work that you're doing, and particularly the work both, you know, as the occupational health nurse, you're working with Williams and, you know, with the private sector. At the end of the day, I do like racing cars. So obviously,
yeah.
You know,
well, luckily so do I. Yeah. So you know, I'm very, very privileged in that role, and I absolutely adore the role that I have and the support that I get in that context particularly. And yes, the motorsport is a very exciting element of the work I do, but I don't take away.
It's only a part of it. So.
Yeah, exactly.
Yeah, brilliant. Thank you so